So, hello, sir. How are you?
I'm good, Ashutosh. How are you doing?
Uh, I'm very fine. I'm like amazing. Thank you so much, sir, for first of all accepting this my request and coming live here. So, for the audience, I must tell every audience that he is Dr. Shine Maheshwari और इन्होंने अपना मास्टर्स स्पोर्ट्स से किया है GNDU से और आप इस पूरे सेशन में जो भी बातें होंगी वो सारा स्पोर्ट्स से रिलेटेड होगा. So before we just go on to question answer thing, there is just few things which I mentioned in all of my live session. Let me just quickly just say this, and then we can just move ahead with the questions, right?
Perfect, perfect. And thank you for
Okay.
inviting me, Ashutosh.
It's my pleasure, sir. It's my pleasure. So for the audience, अगर आप लोगों को कोई भी एकेडमिक्स में कोई भी डाउट हो रहा है तो लाइक आप मेरे वो इंस्टा पे जाइए, मुझे डीएम कीजिए. मेरे व्हाट्सएप ग्रुप का वहाँ पे लिंक भी दिया हुआ है, आप वहाँ पे जाकर के ज्वाइन हो सकते हैं. साथ ही साथ आपका बीपीटी से रिलेटेड जितने भी बुक्स हैं फर्स्ट ईयर टू फोर्थ ईयर और इवन आफ्टर बीपीटी जितने भी बुक्स जो हेल्पफुल होते हैं आपके एकेडमिक्स में, वो सारे के सारे अपलोडेड है मेरे टेलीग्राम चैनल पे और उसका भी लिंक मेरे इंस्टाग्राम पे है. तो आप लोग जाओ इंस्टाग्राम पे मुझे फॉलो कर लो और वहाँ पे जो लिंक्स दिए हुए हैं आप उन लोगों को जाकर के आप ग्रुप से ज्वाइन हो जाओ और टेलीग्राम चैनल को भी आप ज्वाइन कर लो तो ताकि सारे आपको बुक्स एक जगह पे मिल जाए और साथ ही साथ अगर आपको एकेडमिक्स का कोई भी डाउट आ रहा है तो आप उस ग्रुप में पूछ सकते हैं. So this is it. Now we can just move on to question answer things. Sir.
Before
So
we move
before
on
I,
to Ashutosh, I
yes
wanna
sir,
tell the audience, it's a
yeah,
very good platform. You guys can access all the books over there, so it becomes pretty easier. So every time you can't go around carry all the books, and in today's world, we already face whatever problems we acquire, or all the cases are not same. So definitely, it's a quick guide for you to catch on the things.
thank you so much sir, thank you so much. तो सर बिफोर यू जस्ट मूव ऑन टू क्वेश्चन आंसर थिंग, आपने आपसे मेरी बात हुई थी और आपने कहा था कि आप पहले भी ओलंपिक गोल्ड क्वेस्ट में काम कर चुके हो और अभी आप स्पोर्ट्स अथॉरिटी ऑफ इंडिया में काम कर रहे हो. तो आई वुड लाइक टू नो अबाउट योर पर्सनल एक्सपीरियंस और आपने मास्टर्स जेएनडीयू से किया और फिर आप कैसे इन सारी चीजों में आए और किस तरह से आपका वो सारा जर्नी रहा है. सो इन अ वेरी क्विक मैनर, सो आई वुड लाइक टू नो अबाउट दैट.
सो आशुतोष बेसिकली मेरा स्पोर्ट्स में इंटरेस्ट डेवलप हुआ फ्रॉम सेकेंड ईयर व्हेन वी गॉट एक्सरसाइज थेरेपी एज अ सब्जेक्ट. सो
ओके.
उस टाइम पे आई गॉट वेरी इंटरेस्टेड इन स्पोर्ट्स फील्ड एंड फॉर्चुनेटली आई ऑल्सो गॉट I applied for universities and I applied for Guru Nanak Dev University Amritsar as well. So which is again the the main powerhouse of the sports physiotherapy.
Yeah,
So
actually.
they are already having 26 student that get passed from MPT Sports in Guru Nanak Dev University, which is maximum all over India. So I got admission and which I dreamed of, and I completed my masters from there. And yeah, starting was a bit of struggle when you start your career in sports physiotherapy. It's not a regular job, so you have to be available in sports. You have to be like around the clock 24/7. So yeah, the journey went and slowly and gradually I was working in Bangalore. I was working in Mohali as well for a couple of years, and then I was working with OGQ, and now finally I'm working in Sports Authority of India, Sonipat.
ओके सर, ओजीक्यू के बारे में थोड़ा सा बात करना चाहूंगा मैं क्योंकि वो मेरे लिए भी नया है और मेरे ख्याल से ऑडियंस के लिए भी. तो आपने ओजीक्यू में कैसे काम किया? लाइक अगर मान लीजिए कि मैं एक स्पोर्ट्स फिजियोथेरेपिस्ट हूँ, मैंने जीएनडीयू से नहीं कहीं और से किया है, तो मैं कैसे ओजीक्यू में काम कर सकता हूँ? ओलंपिक गोल्ड क्वेस्ट फॉर द ऑडियंस
So
फुल फॉर्म.
there are regular
हाँ.
vacancies in OGQ. So आप वहाँ पे अप्लाई कीजिए and if
ओके.
you're experienced enough like according to their eligibility criteria, they'll definitely give you an interview call, and once you
ओके.
crack those 4 or 5 rounds of interviews, then you can get selected. But yeah,
5
they have
राउंड
a
ऑफ इंटरव्यू.
some 4 or 5 rounds are there,
ओके.
and now the trends are changing. So according to that, I think there might have changed. I'm not sure about it, but
ओके.
yeah. So it's a tough process, but again,
ओके.
yeah, OGQ is a very extreme organization for sports, and it's one of the leading sports provider in India.
ओके. तो सर इसका एंट्रेंस एग्जाम वगैरह भी होता है ओजीक्यू का या फिर सिर्फ इंटरव्यू बेसिस पे?
I know it's majorly on interview basis, and
ओके.
they try to what have you worked, what have your past experience, and
हम्म.
they take only sports physiotherapist.
ओके.
Actually. So
गॉट इट.
and it's a pretty organized job you have, and
ओके.
yeah.
तो सर थोड़ा इनसाइट्स देंगे, आप किस तरह का जॉब वहाँ पे करते थे, कैसा आपने केसेस वहाँ पे
So
देखा है,
I
किस
was
तरह के?
majorly posted with archery. So I was
ओके.
taking care of archery people. So OGQ has a number of sponsored athletes.
Okay.
So I was taking care of those, and majorly I was taking care of one of a player who's currently in Olympics now.
Okay.
So she, yeah,
Congratulations.
she is, yeah. Thank you. And she scored like among the Indians, she was among three players. So she is currently ranked first. And among the
Wow.
whole tally of in ranking round, so they have a ranking round before proceeding to matches.
Okay.
So she is currently number 11.
Okay. Okay. Got it.
Yeah.
So that is actually pretty much amazing that she got selected in Olympic, and you must be feeling proud for
Yeah,
her.
luckily it's a very good news. Like today only we got
Uh,
the one Olympic medal, bronze medalist, one Manu Bhaker.
oh
So we
wow.
already yeah. So it's a very like I'm fortunate enough to have this session conducted on today. So like
Okay.
this is the first like Olympic medal for a woman in shooting.
Wow. This is
Yeah,
actually amazing.
like
So,
almost 1 hour back only we
mhm.
won this medal. So yeah, that's how we
Wow,
open the medal
sir.
tally.
This is so amazing. Even I am very glad to hear about it. So, sir, actually, can I just know a bit more about OGQ? Like, what do OGQ do? Okay, it is an
So OGQ
organization, or
is
is
like, yeah, it's an
hmm,
organization, it's a non-government organization. So what they do is they tend to select some players depending on their
okay,
performance, or they are supporting some players like when they were in their initial training days. Like
okay,
Lakshya Sen is one of them, and some other
okay,
players are also there. So
hmm,
like they have those select those players, and from everything like from their traveling to their rehab part or their conditioning part, so they take care of, and accordingly they provide the support staff or the coaching for the excellence programs. So that's how they were
got it.
supporting. So like I was working with well, like I told you, I was traveling with a player. So that's how like whenever there were matches or there were qualifying tournaments, or so these and actually they have 4 World Cups in a year.
Okay,
So yeah, for those trials happens. So like I was there
okay,
in the trials and working with the player, and so
hmm,
matlab, she was currently matlab, she was that time I was recovering from an injury. So
okay.
the whole rehab plan I was designing, and accordingly we were working.
So, can you just
OGQ
tell
provides
which?
us the platform.
Okay.
Yeah, OGQ
Mhm.
tries matlab, provides us the platform so that the things go smoothly.
गॉट इट गॉट इट सर आपने जो इंजरी का जो केस आपने देखा वो क्या इंजरी क्या था वो कुछ बता सकते हैं इसके
So
बारे
basically, it was a shoulder complex injury, and
में
majorly
ओके
labrum tear was there, and
ओके
we didn't want to go for an surgery because we
ओके
felt after like with the major surgeons and orthopedicians as well. Plus, we have the whole sports science team in the OGQ which backs up, which like try to have case discussions, and if like you want to inquire about something, see, human body is something that you can't be sure of, or there is no
वेरी ट्रू
such thing that you can like this is the ultimate treatment. No, there is no such treatment. You have to, it has to be tailor made. So yeah,
एग्जैक्टली
we were open for discussions. We used to discuss cases a lot. How was the performance going on? We were monitoring the workload, like how many arrows and all whether the player was shooting. So accordingly, we came to a conclusion. We'll do conservative management. We were doing. It took, yes, it took a long time, but yes, today is the result that we got, and
या
she is completely pain free.
Amazing. Sir, before I proceed to the next question, I just want to tell you that I am a sports physio enthusiast. Like I have spent most of my time, even though like I don't read that frequently, but मुझे sports physiotherapist और sports के जितने भी books हैं मुझे काफी लगा हुआ है और इसलिए मैं मतलब WhatsApp पे भी आपको बहुत तंग कर रहा था कि सर ये जानना है वो जानना है करके so this was the only reason and which is why I want to know about these things in detail because this actually makes me very excited about it. तो मुझे बड़ा पसंद आता है एंड द सेकंड थिंग इज सर तो ओजीक्यू का आपका ये जर्नी मुझे मतलब आपसे ये पूछना था कि एक स्पोर्ट्स फिजियोथेरेपिस्ट जैसे कि आप हैं अभी ठीक है तो कोई एक स्पोर्ट्स फिजियोथेरेपिस्ट क्या एक ही तरह का कैटेगरीज में काम करते हैं या फिर आप अगर स्पोर्ट्स फिजियोथेरेपिस्ट हैं तो आप आर्चरी का भी केसेस आप आर्चरी के साथ भी वर्क कर सकते हैं आप क्रिकेट के साथ भी कर सकते हैं ऐसा कुछ होता है या फिर कोई एक के साथ ही आप
No, so
रह सकते हैं
OGQ is like it supports only Olympic Games. So it is
ओके
not bound to cricket. And secondly, like what you ask is like regarding one game or so. So usually the thing is कि, in the initial phase they set a domain like what role you have, and they try to inculcate you for that only. And if
ओके
required, yes, you can change roles. Like if my player is completely free of like, say, matlab, has already didn't do sports, So definitely my role ends there. But like in archery, they have many players, and with the support of
Okay.
Sports Authority of India, definitely. So the whole thing is. Like in archery they have many players like I told. So it's like they are not just confined to one place, you have to take care of other players as well. So yes, if you are completely like, if you don't the requirement is not there, and when there is off season, so yes, your role can be changed and you can shift to other games as well.
गॉट इट। तो सर आपका ये ओलंपिक गोल्ड क्वेस्ट तो फिर आपने जॉब किया, फिर उसके बाद आपने स्पोर्ट्स अथॉरिटी ऑफ इंडिया पे शिफ्ट किया, लाइक उसके अंडर आप काम करने लगे। तो उसमें काम करने के लिए फिर आप थोड़ा-सा उसके बारे में डिटेल में बता सकते हैं कि कैसे काम हो आप कर सकते हैं उसके अंडर में, कि एंट्रेंस वगैरह सारी चीज़ें वो?
Yeah, so like SAI is like Sports Authority of India. They have there was recruitment. This time there was a mass recruitment in the name of high performance analyst.
ओके।
So again, the government is focusing towards these days a lot more towards sports. In the last decade, you can see a whole lot of changes in the sports, and
या एक्चुअली।
yeah, so very bright side. And the government of India, and especially our Prime Minister Modi ji, he has also like started various programs like again Fit India movement, Khelo India is there.
हुँ, हुँ,
And
हुँ, हुँ।
like I told you, I was it's a bit think, but like last week we were going through this assessment. I was so Kirti is something like rising talent identification program for the year of 9 to 18 age group people. So that is a program for the rising talent. So
ओके,
again, athlete is not made in a single day. It's take a whole lot of a journey for the not just the athlete, the whole family and the coaches, the support staff. So they have begun these programs, and in foreign we have already the long-term athlete development programs are going on. Slowly and gradually, we are also catching up with the pace for grassroots modification and nurturing the talent in grassroots level. So, which is a very good thing that in today's world, like this is happening in our country. It's a very proud moment for us.
सर
And regarding the
तो
recruitment process, yeah.
हुँ, हुँ,
So like
या
again, there was a interview, and
ओके।
the eligibility criteria was checked, and according to that, so like we were hired.
तो देयर इज़ अगेन नो एंट्रेंस एग्ज़ाम बट जस्ट द इंटरव्यू?
Yeah, it's just the interview.
ओके, सो
So
इफ
they
यू कैन
are
इफ यू
again there are marks based system that is there according to your qualification and your experience and your past like whatever your work experience related to sports was there, so they
Mhm.
count that.
Okay. So do you remember the eligibility criteria or
Yeah, if I'm not wrong, like the eligibility criteria was 3 years of working experience in sports,
okay,
and again masters from sports, and
okay,
desirable again if you have worked with any athletes or like how many years you're working in sports.
okay, ओके। तो अब सर आपका पूरा का पूरा एक्सपर्टीज़ चूँकि आर्चरी के ऊपर ही है, तो मतलब जितने भी सवाल हैं मेरे वो उसी के इर्द-गिर्द हैं, ठीक है? तो पहला क्वेश्चन तो ये था सर कि ऑन फील्ड असेसमेंट और ऑफ फील्ड असेसमेंट के बारे में थोड़ा मुझे जानना था कि हाउ व्हाट्स द डिफरेंस और किस तरह का काम होता है ऑन फील्ड असेसमेंट और ऑफ फील्ड असेसमेंट?
All right. So I would here ki like these days I'm currently posted with looking after care of kabaddi players.
ओके,
Yeah. So I'm taking care of kabaddi players, not just
ओके,
confined to archery game. But yes,
ओके,
for
ओके,
a major part of time, I was there in archery itself.
ओके,
Uh, yes, so like on-field assessment and off-field assessment, we go through like when you are there on-field. So we try to go on the field when they are training. So some more.
हुँ, हुँ,
First of all, like if I tell you about the regarding the assessment, na, so on-field is always about you. First, you need to know the insight of the game. So the more
ओके,
you know about the game, then only you will be able to know what kind of training load is there or what exactly is the requirement of the player in that particular game.
वेरी ट्रू,
So that's why you need to first go through the complete game scenario, how the training things are there, what type of training they do. So that is, I think, that is foremost important regarding the on-field assessment. Second thing is ki, like in particular if you talk about archery, so yes, you need to know about there are some measures like especially about shoulder testings are there in pre-participation examination. So in which we measure the
व्हाट
your
एग्ज़ामिनेशन डिड
blood
यू से
glucose.
दैट? व्हाट एग्ज़ाम?
Pre-participation examination or musculoskeletal evaluation.
ओके,
These
आई हैव
days we
नेवर
are
हर्ड ऑफ
going.
इट।
All right. These days we are going for, if you are familiar with functional movement screening test. FMS is the one that we generally do for
I
athletes.
think I've heard about it, but I don't know what that
So
is
basically, it's
exactly.
a 21 rating score question
Okay.
when which you analyze movements,
Okay.
and these some simpler movements are there, like you go for shoulder reach test, and you go for deep squat test, inline lunge test. So these are the ones that you go for the overall, takes your overall mobility and strength as well.
Okay.
So
I'll just
like it's
surely check
a,
it out.
yeah, so it's a like thinky, like if your score is less than 15, so you must take care of it. Like before, it should be par. At least 15 is the par number for the athletes. And yes, definitely there is scope of improvement in every athlete. So that's how we try to, regardless of what level they are today, only we try to go for the graph should go in a increasing manner. So that is
Okay.
the foremost. And regarding the lab testing or the off-field assessment, it's more of like what level are there at today. Like in like we used to do it, like we would do in lab testing. What we tend to do is we have the whole interdisciplinary approach from physiological testing to SNC testing, from MSK evaluation that we physios do, and from biomechanics to psychologists we all have. We are lucky to have those all under one roof. So that is also a thing that helps us to identify more and more injury prevention, helps us to identify the problems, which helps to further formulate our injury prevention regimes.
Okay. So this actually is for the layman people or who are very new to this field. Can you just explain in a very simple terms what is on field and what is off field assessment?
So off-field assessment is when you, what you do is for the game sake. Like if I tell you about like my game is there next day, or if I can say it's like on-field that you do, what test you can do on-field. So those comes under your on-field assessment. And regarding the off-field assessment, that is the overall body evaluation, like what measures that you need to take care of, or the overall ranges. So it would be more on-field is more like when you, how do I describe this in a layman? Something like a, it would be something that would more crucial to your movement analysis or your related to
Okay.
game.
Okay.
Because in
Okay.
archery, that the movement that you do, that is more reliable on just shoulder and the back. Although you can't, again, the it's a 3 hour standing job, so again you need to go for the core evaluation as well, or the balance
Mhm.
way that you check. So these are also necessary assessment parameters that you need to take care of.
Got it. Sir, the next question is actually about the scope in sports physiotherapy. So I would like you to answer that.
Yeah.
And also,
So that
sir,
is.
there is just yeah,
You were
sir.
saying?
Sorry to interrupt. I just
Yeah.
want you to give an insight about the salary of a sports physiotherapist. Like, I don't want you to give me the exact number, but approximately, if you're comfortable. Okay.
All right. So definitely a very good question for the, I think, the budding physios who are there in sports physio. So yes, in initial days you will face some difficulties definitely, if I be truthful about it. But regarding the number of opportunities, there are n number of opportunities these days. If you yourself see in your area only, there would be at least 5 to 5 academies of different games that I can share without hesitation. Like there would definitely be there. The local academies must be there. So yes, they, until unless we guys only spread awareness about that, it's not the fault of athletes that they don't know, but it's our fault or we are lacking somewhere. So to spread awareness, all right. So it's our role. We need to take initiative for that and teach them what exactly the right manner, or and trust me, we can see a lot of changes in the last decade. Like I told you, so sports is an emerging, it's still emerging field. So a number of things are going on there nowadays. Para sports is also into much of a like game these days. So there are a number of opportunities that are there. Only thing is you need to grab those opportunities as much as possible. So like
So your
what my suggestion
actually
would
camera
be,
angle is
yeah, just
shaky.
a second. So my suggestion would be to go like visit your around surroundings, go to those academies, and try to know more and more about the game. See, again, you are the, from the medical background, you are the movement expert over there. So until unless you are only sure about the game, So that is the basic foremost requirement according to me. You need to be aware about the game itself. And hang on a second.
So yes.
Yeah, sorry for the glitch. Yeah, so
Yeah,
I was telling
it's fine.
about the more thorough you are with your basics, the more thorough you are with the game. I think that is the foremost, and the more you visit, the more you are aware of your surroundings. I think you should start over there. Like if there is any stadium nearby you, if there is are any academies, you visit those places. Tell about your like what sports physio do, and I think yes, you will definitely catch on. Regarding the
Just
salaries, I would yes
mhm.
definitely say कि even these organizations, these leading sports organizations, they are paying a handsome amount of salaries. And second thing is you can again open your own clinics. Sports clinics are there these days, and I can see a good amount of money they are already earning. Only thing is you
Yes.
need to start. You need to more aware about it.
Okay. So if I'll talk about salary, sir,
Mhm.
लाइक वो उतना ही अमाउंट होता है जितना एक नॉर्मल फिजियोथेरेपिस्ट का होता है जो गवर्नमेंट जॉब में, या फिर उससे ज्यादा या उससे कम, या फिर उसी के अराउंड वो होता है सैलरीज?
No, I think it may vary, but it is on a higher side. Like comparatively, if I talk
ओके,
about the
हायर
ratio,
साइड.
yeah, it's on a higher side because if you're good at your what you do, again, not just comparing among the physio fields as well. Like if I say neuro people and cardio people, they are also earning handsome amount of good. Only thing is you need to prove your worth. So if you're
या
worthy,
एग्जैक्टली.
definitely yes, there are people or there are organizations that are paying you handsomely. See again, if you are
ओके.
developing that trust, or if one player is coming to you, or regardless of say like if I tell you about a patient, so if you gain that insight of the problem, and if you like resolve that, na, ev- the player or that patient will definitely is going to come to you.
गॉट इट. गॉट इट.
So I think you
गॉट
should
इट.
be more focused about your goals, and you should be clear about your vision. What exactly is the one that you need to focus, that you need to strive from the player, and think about long term rather than short term. And I think that will be the long in the long run. It will definitely help you.
Sir, whose decision was that? Was it yours or the organization decision to put you in archery, kind of thing?
So it
Like,
was, if I tell you about, so I initially it was organization's decision, and
okay,
I was also enjoying the game.
okay,
And the more and more I got to know about the game, it looks like there is no much to the game. But when you actually get to know about the game, the things that you learn, and today in today's world, if you ask me, I am confident, or I'm not ashamed to say, ki, like even there is a lot of learning to yet take place for me. Like there are many things that I can still do or to improve the performance of the players, and I am still learning what I'm doing. So still I
so
discuss cases with my fellow colleagues, I
yeah.
mentors my seniors, and yes, there is always scope of improvement in any game.
What sports do you like, sir?
So kabaddi and I think TT were of my foremost
TD?
that I used to like. Table tennis, yes,
Okay, table tennis. Okay, got it, got
yeah.
it. So the next question is actually about the advancement in the current scenario in sports physiotherapy.
So advancement in current sports physiotherapy is like I would like to add on ki, like see again, advancement doesn't mean like you have to remove your basics or completely rely on advancement. Like these days I'm seeing trend what are the trending therapies are going on. So there is no such thing in or fancy treatments are there. You have to stay what your like what I emphasize on is major manual therapy. Yes, that is foremost
Yeah.
important. But yes, you need to keep yourself updated in today's era, whatever the requirement of the hour is. Like in sports physiotherapy in particular, if you say you don't want to go player off the field, that is the time that you need to be strict about your decisions, and try to be not self-oriented. Instead you need to be athlete oriented at that time, what is morally or ethically right for the game.
Exactly.
So that is foremost important. Like yes, there are many testings these days for rehab purposes as well. Like nowadays, 100% anti-gravity treadmills are there. We are having the opportunity to go for underwater treadmills. We are having isokinetic dynamometers that are there for the
What's that?
testing. Isokinetic dynamometer is the one that you helps you to analyze the strength ratio.
Okay, got it.
So
Got it.
basically, in if you see, there are majorly injuries are in rugby and football.
Hmm. Very true.
So yes, they have already introduced their sports medicine program, and many things are there that you need to currently update yourself as well. So these will help you in identifying and keep you updated as well. Like I was mentioning, you asked about echocardiographic dynamometers. These are the ones that help you to analyze the antagonist to agonist ratio as well. So like
Okay.
I know कि my football game is for sprinting majorly. So I'm bound to know कि like my hamstring and quadricep they should be how much should I train? Should I focus more on hamstring? Should I focus more on quads? So in that era, you have a fixed definite amount of literature is there. You can compare. So 0.67 was the like initially 0.67 is the ratio that goes for hamstring to quadriceps strength. So that is one thing, and nowadays we have GERD to GERG ratio. I think so. The basic for that, the shoulder injuries, like if I talk about those throwing events, so definitely their internal rotation is deficit because the external rotation is much
Throwing,
required.
what did you say, sir? Throwing?
Throwers. So
Get you. Like,
in
what's
athletics,
that?
they have a category for throwers. So like javelin throw, shot put, hammer throw.
Okay, so it
Yeah.
is a
So
category of sports, right?
the category of sports. Like
Okay, got it.
we all know Neeraj Chopra last
Yeah.
year who won the Olympic gold medal. So
Ishan
yes,
Marwas or
definitely
was
Asian. Yes,
his
yes, yes.
personal.
Again, he's a physio. Yes,
Yeah,
yeah.
I know him. Actually, I saw most of his posts, and I have sent him a friend request. A very like, I don't even remember the year when I sent him a friend request, and I
All right.
usually
Yes,
go
he's
through
quite
his post and
definitely. I
yeah.
didn't met him personally, but yes, when Neeraj Chopra was training, like luckily I was during my master's tenure, I got opportunity to visit NSS Patiala as well.
Okay,
So that time, yes, I was fortunate enough to like see him train, and I got a real insight about how the testing works. So it
okay,
not just like in sports, if you talk about particular, you are it's not just a one man show. So you need to be more interdisciplinary approach should be there. So the more and more you interact with your fellow colleagues or more departments, like it is not a one day process.
exactly. That is
So I
agree.
think that is foremost important, and yes, we all can see the result.
Yeah. So, sir, do you use like dry needling, cupping, these kind of
Yes,
things? Or,
definitely, definitely, definitely.
yeah,
But
you
again,
use
like
it.
what I would like to introduce Ashutosh कि जितना अगर we should be whatever we are using, we should be like completely familiar with the things. Like if I use dry needle, I should be knowing कि what exactly I should first of all what I feel is कि हमें सबसे पहले red flags अपने पता होने चाहिए. हमें क्या
Okay.
नहीं करना. I think वो सबसे foremost important है before you do
Contraindication
anything.
is very important.
Yes. So until unless अगर आपको वो नहीं पता होगा तो I think you can do something bad as well. So that is so I want like before doing it or before actually practicing on people or athletes, you should be knowing the facts about it. You should be certified trainer to do that. And yes, we have many people out there who are specialists in that and they train you that. So only thing is like what I feel is, and our sports physiotherapy is also changing a lot. Our curriculum is also changing. So it should be introduced in what I feel is ki, I was lucky enough to get to know during my masters as well, and but I can't. I definitely know the scenario, and that is not there everywhere.
What scenario are you
So
talking about?
like again the modern concept of taping, dry needling,
Okay.
these are something, yes, that is the adjunct of a treatment but not the wholesome treatment. But you should
Yeah.
be completely aware of the treatment what you are doing is, and it should always be towards the welfare of the athlete. So what my
Very
like in
important.
my long term goal should be the welfare of the athlete. And yes, there can be measures or like electrotherapy is one thing. Like They are very good techniques for, like, we use laser as well, we use shockwave therapy as well. Yes, but again you need to be decisively correct ki what you are doing and why you are doing it. Should have
Got it.
so for that you need to be currently like completely aware of your literature, try to read as much as possible, and trust me, jitna aap padhoge, jitna you'll get to know more and more. There is many things, and there are too much is there. Nothing is like कि I know all of it. जब जिस दिन आपको, आई थिंक जो मेरा पर्सनल वो है कि जिस दिन आपको, अगर आपको लगता है कि अगर आपको सब कुछ आता है, आई थिंक इफ देयर वाज अ लाइन इन थ्री इडियट्स इफ आई एम नॉट रॉन्ग, कि अगर आपको सब कुछ आता है देन यू आर इन द रॉन्ग क्लास, एंड इन द
Got
मेडिकल
it.
बैकग्राउंड इफ यू आर
Yeah.
देयर, तो यू नीड टू बी कंप्लीटली लाइक जितना आप पढ़ते रहोगे वो जरूरी है,
पूरा
बिकॉज यू आर
समंदर ही
डीलिंग विद
है,
लाइफ.
like you
यस.
can't know everything, you can't know everything. This is very true, you can't know everything. So what you're
एंड
just saying
एवरी
is कि
एथलीट इज नॉट सेम. आपको अगर सेम सिचुएशंस भी है, लाइक इफ आई एम डायग्नोसिंग अ प्लेयर विद सेम इंजरीज, बट हो सकता है उनका रिहैब और उनका पूरा ट्रीटमेंट प्लान कंप्लीट डिफरेंट हो, because again no individual is same. So there is nothing called as fixed treatment or something like that. You need to be all like all eyes and ears should be there, and completely, and like I told you, it should be always be athlete driven. So what are the requirements of the athlete, and
got it.
depending on the
So
game,
this is how
what
you
game
plan
they
a
are
goal.
into. Yeah,
Got it.
because
So
the
sir.
demand of the game also may change, so that's why your
Mhm,
treatment will also change.
mhm.
Like
Got
if
it.
I talk about the aerobic fitness or about the anaerobic player, like if a sprinter is there and if a marathon player is there, so their and treatment would be entirely be different.
Got it. Got it. So basically, what you're saying is कि electrotherapy is one part, dry needling, cupping is one part, but they are not the only thing which you should do. And you should know
Yes,
about the limitation of certain things. Like you should know about the limitation of dry needling. कि हाँ ये dry needling अगर मैं कर रहा हूँ तो इसका इफेक्ट क्या है और इसका लिमिटेशन क्या है और ये क्या कर सकता
exactly,
है. हाँ.
exactly.
और सिर्फ ड्राई नीडलिंग करने से कुछ नहीं होगा. रिहैब प्लान इज देयर एंड
Yes, yes, yes,
कम्युनिकेशन
yes.
कम्युनिकेट विद द पेशेंट बिकॉज द पेशेंट विल टेल यू कि आपका गोल क्या होगा. दैट यू विल नो आफ्टर कम्युनिकेटिंग विद द पेशेंट. गॉट इट.
This is not
सो
just to like demotivate or demoralize the coming or the budding physios, but yes, I have seen some trends. Like I know needling, I'll go for needling. Yes, needling is a treatment, but again, it's a one tool in your box. There are
या
n number of
एग्जैक्टली.
things that you can do. So what
एग्जैक्टली.
you
एग्जैक्टली.
feel is ki, like it might be the change of opinion. Yes, definitely might be there, but again. Like I told you, your what your rationale is. आपका treatment के पीछे reason क्या है? What's your goal is? So again, you might not be wrong, but you should be like able to justify what is right. And again, for that you need to have ample amount of knowledge, or jitna evidence based
गॉट इट.
practice you will follow. Yes. And like current trends, jitna aap you will read, jitna you will try to follow, and hands on is more important. Like I'll share a personal experience. Like till my bachelor's, I was lucky enough to get very good teachers and mentors during my bachelor's time, and like I mentioned earlier in the earlier phase, ki, like I was more into sports physiotherapy, but when I during my master's tenure, I was lucky enough in Amritsar, so we have all major games are covered in university, and recently they won the Maka Trophy as well for games.
ओके.
So yeah, so but again, like the athlete is something totally different from the normal population. So the more you'll try to go for treatment, try to be more like work more, so then only you will get that insight or that experience to work with athletes, because the normal population and athlete population is totally different.
अग्री.
So I
अग्री.
think that was my something personal experience which helped me a lot during my master's tenure. I used to work a lot, I get more and more hands on, and that helped me a lot.
Got it. So sir, what are the kind of manual therapies that you do on a regular basis?
So there are different therapies, like you can go for mobilizations, you go for
Okay.
uh, uh, transverse friction massages are there. There are MET techniques are there. So different things are there, and you can add on with your exercise therapy. Yes, definitely the movement science, that is foremost important, because at the end of the day, your athlete has to perform. And second thing is like what I generally prefer is ki there are, see again there is a vividness of the injuries or like vividness of the treatment, but yes I definitely try to include those exercise movement patterns. And yes, in if I require that, so I can use the functional electrical muscle stimulations are there. For advanced healing I use laser as well. For tendonitis cases I feel shockwave is pretty good. So that's how treatment changes and varies, and depending on the requirement of the game. So at times I need to tape those players as well so that they can practice, and I need to deload certain muscle groups. Or as a preventive measure, we also use taping or equipments. So
Got it.
that's how you should be like completely aware of the game as well. Like, what are the demands of the game? So that's how you will be able to formulate the injury prevention program as well. So
Got it.
yes, definitely injuries are part of the game, but I feel ki physios are like they can be as a movement expert. You guys are the perfect ones to set up an injury prevention program because you know what muscles need to be there or what kind of more injuries the players are prone to. So
Can't
each
agree
game
more.
has different set of injuries. Yes.
Yeah.
So yes, injuries are part of the game, but what you can do is reduce those incidents of the those injuries that
Got
can
it.
be done.
Got it. Sir, before I move on to the last question, I just want to ask you this thing that I've seen most of the reels in Instagram. There is a part in the like sports rehab plan that is conditioning part. तो अगर मैं इसको आपके आर्चरी वाले पार्ट से अगर जोड़ूं तो कंडीशन आप लोग भी करते ही होंगे एथलीट्स का तो वो किस तरह का उसमें क्या लाइक अगर उसको एक बॉक्स के टाइप अगर हम लोग देखें तो उसमें क्या क्या चीजें इंक्लूड होती है कंडीशनिंग पार्ट में
Sure, Ashutosh, sorry, I'll go around the question first. Ki, like these
हाँ
days,
हाँ
reels and are like these short videos are very trending. But again, I would not like you being the expert over there. So don't just focus on the those short videos because you don't know the situation or the condition of the athlete that particular moment. So it may do very harm. It may be very harmful as well. So that is one thing that you should be doing. And second thing is yes, regarding the conditioning program. So we have SNC experts as well along with us. Or what we do is ki, like generally I need to focus on this if a particular muscle group is there. So yes, that conditioning program we tend to set up, and if required, we usually take the help of the strength and conditioning expert as well. So it's like I told you earlier as well. It's not a one man show or like it's not a one man job. So you should be open to communicate with the team. The more and more you communicate, the more and more you will get to know about the player in the players data. So and these
सर
days data, yes, like I sorry, I am mentioning you again this like you told about the career opportunities. Yes, data is also one thing that sports science data is the one such domain that has opened a lot these days, and many people are going to data science as well. So that is one thing as well, and many people out there was already working that. So research is something like totally a different horizon, and many research projects are also there. So in sports itself, I'm not just talking about the whole population. In sports itself, many datas are going, like many researches are going on. So that is also a job opportunity that players can go, that physios can go into.
ओके सर मतलब कंडीशनिंग इज वन पार्ट ऑफ अ रिहैब प्लान व्हिच इज वेरी
Hmm.
ट्रू तो मतलब मैं वापस से एक बार उस पे आऊंगा कि उसमें इन जैसे कि हर स्पोर्ट्स प्लेयर का वो अलग अलग होता है उसका गोल अलग अलग होता है व्हिच आई लाइक ट्रूली एग्री विद यू तो अगर मतलब आपने भी तो उसके साथ काम किया होगा तो अगर
Yes.
कंडीशनिंग में आता क्या क्या चीज है कि अगर मैं जैसे कि
Conditioning may
एक्सरसाइज तो
depending on
है
your depending your parameters. Like if I talk you about the aerobic fitness or my
ओके
speed training, my agility
ओके
training. So if
ओके
I train speed for a marathon player, so that
ओके
is not my goal. It should be more of a aerobic fitness, like in which I'll talk about the more of VO2 max. All right, that is one thing.
हम्म
If I talk about the anaerobic player or a sprinter who's a 100-meter sprinter, so it doesn't mean need aerobic training. Yes, definitely some part is that 20% would be aerobic training, but 80% would be more of an anaerobic training. That is your
गॉट इट गॉट
phosphocreatine
इट
system. So I need to train that. So first of all, like I told you about, you should be aware of what kind of athlete you are taking care of. So according to that, your demands will vary. Like you mentioned, ki, like there would be a different training scenario. Yes, definitely, and you have to be thorough with that. What percentage of or what training you should be giving to those players? Like if I need to be training about the sprinter, so I would definitely focus on my fast twitch fiber. Like I will be focusing more on the anaerobic system or the phosphocreatinine system that I need to train.
बिल्कुल
So I'll
बिल्कुल.
be focusing more on the speed part, and accordingly,
Got it.
like if I'm working on the like a kabaddi player, so I would be focusing more of a plyometric strength that should be there, which is not required for an archer.
बिल्कुल बिल्कुल. So got it. So this is actually the last question, sir, and then we can just end the live session. I just want to know about the names, like how many cases we have treated so far, and can you just give us few insights about that?
That would be a pretty large number. uh,
Okay,
so
so
yeah, so
I
like
am
we have currently in our NCO, like if I tell you about, more than 300 athletes are there. So it's been almost 2 years since I've been in SAI. So yes, definitely.
okay.
And in my previous organizations, I was working with athletes. So before that, when I was there in OGQ and Bangalore, then also I was serving with athletes. So definitely, number is such thing that you can't keep a track record of.
Okay,
But
got it.
yes, yeah,
I
from
just
from shoulder to your great toe, yes, I've seen many cases. And for like regarding my experience, like I have mentioned before as well, कि no case is similar. So again, your approach should be like from shoulder tendinopathies to post-op ACLs we have seen. Then accordingly, it's a protocol is tailor-made. When you are there with
so
the athlete, you can't.
yeah. So, sir, I'll just reframe the question. So,
Mhm.
the thing is, that, like, I'll ask the question again.
Yeah, yeah,
So, what
please.
is the most difficult case you have ever came across? So,
So Ashutosh, like to answer this question, see, there is no difficult case or no good case in my opinion. And
सर
yes,
कभी
definitely
केस को
there
ऐसा
are
देख करके
nahi,
नहीं
there
लगा
are,
कि
like I told you,
हाँ
ki there are some cases where you don't get the improvement. So that's how your team works, or your your pioneers in the field works. Ki like yes, like I told you, ki I still discuss cases with my seniors, with my colleagues, with my juniors as well. So like we were discussing before the live session itself, ki like we still have a word, right? Ki like what can be the process, or what, how we can improve the our treatment strategies, and that's how we need to go more and more communicate about it. So yes, there are many cases even for like yesterday what case I discussed. I had a word with my senior, like how can we improve that. So there was a case regarding ankle that I was treating, but it was not getting better. So I discussed with my senior and wanted to what we were talking about. Yeah, needling help. So again, we just can't be confined to our scenarios like what we are treating. You should be open again. Like I told you, it should be a more athlete-centered approach should be there from athlete's point of view. And at the end of the day, yes, you need to take care, or you need to treat the root cause of the problem, not just the symptoms, because I don't want the athlete to, yes, return for me for the same problem.
सर वो एथलीट सॉरी वो जो एंकल का केस आपने बात किया लाइक वो केस का क्या था वो और वो किस
So
एथलीट में हुआ था.
basically, it was more of the continuous loading phase. So because of a kabaddi player, you have to. He was a raider, and the 4 foot landing was there. When you have to, there is a skill called taking a bonus.
Okay.
So yeah, that was the thing, like where we can work on. So I was not able to give much of a symptom. I was going for, with the help of taping, we were reducing symptoms, but the pain was not going through. Then we asked the coach, had a word with the coach, like we need to take some time off the field so that the problem doesn't increase, because the Pro Kabaddi League is also coming. So the player has to be ready for that as well. So when with the help of coach, we got the time, and with one of my fellow colleague as well. So we identified the cause. We worked on some lending techniques, and yes, it helped better, and the player is performing well, and he's
सर
completely free.
सर बहुत सारे ऐसे केसेस होंगे जो कि आपने बहुत बार देखा होगा कि मतलब
जी.
हालांकि ठीक है बॉडी का स्ट्रक्चर अलग है मैकेनिक्स अलग है तो देयर कुड बी सम पार्ट ऑफ इट लाइक इट कुड बी डिफरेंट, बट ऐसे बहुत सारे केसेस होंगे जो कि सिमिलर होंगे. तो व्हाट्स द मोस्ट कॉमन केसेस दैट यू हैव सीन इन एथलीट?
So, like, if I tell you about, I'd be like telling you this answer, like number of cases depending on the games. So,
Okay,
like in
again, yeah.
archery, if you in archery, if you see like tendinitis, supraspinatus tendinitis is one of the very
Mm-hmm.
like case that you will see now and there because of the shoulder movement or the number of arrows they shoot. So, which is pretty
Mm-hmm.
much common. Regarding kabaddi, yes, cock thigh you will see because of contusion injuries,
What's
ankle
cocktail?
sprains.
Okay.
Yeah, so that is the
Uh-huh. Oh.
the quadriceps strain that is
Mm-hmm.
there.
Got it, got it, got it.
So yeah, that is there.
A blow to the thigh, that if I'm not wrong.
Yes, and in sprinters you'll see definitely the hamstring strain that are pretty common.
Mm-hmm.
Ankle injuries are also pretty common in kabaddi players, so
Mm-hmm.
that is also one thing you will find very often. And
Okay, got it.
yes, mobility
Got it.
is one thing that we need to take pretty care of. The again coming back to basics, what I feel is your warm up sessions, your cool down sessions are very important, because if you are not ready for the moment itself, so definitely you are more prone to injuries. Like if I tell you about even the lab testings in today's we are in so much modern world, but still the lab technique is far more different from the real actual game like scenarios. So yes, you need to open your horizon, and the more
Yeah.
your vision is, that is I think foremost important.
Okay. So actually the questions are all finished. ये last का जो like question है वो मैं सभी से पूछता आ रहा हूँ और आपसे भी पूछूंगा. ठीक है.
जी.
और ये क्वेश्चन एक्चुअली बहुत इजी है. लाइक देयर इज नथिंग टू वरी अबाउट. मुझे बस ये जानना है कि लेट्स से दैट आई ग्रेजुएटेड, आई डिड माय मास्टर्स इन स्पोर्ट्स फिजियोथेरेपी. लाइक आई डिड माय मास्टर्स. तो अब क्या है, मैं एक न्यूबी हूँ, तो मुझे तो अभी कुछ नहीं पता, मुझे एक्सपीरियंस भी नहीं. सो लेट्स से व्हाट आर द क्वालिटीज आई शुड हैव as a sports physiotherapist which will help me like in my career building thing. तो अगर एक बॉक्स हो, आप उसमें क्या क्या चीज भरते जाएंगे कि ये भी होना चाहिए, ये भी होना चाहिए, ये भी होना चाहिए, ये भी होना चाहिए. तो बस
So,
दिस इज
as
द
a
एंड पार्ट.
sports physio, like first of all, my advice would be to be as skillful as possible. Go stick to
ओके.
your basic. That is the foremost important. But yes,
ओके.
communication and personal development is one such thing. How you present yourself.
ओके.
That is
कम्युनिकेशन
for yes,
स्किल.
communication, personal development. That is
ओके.
again how you are able to see. Communication is such thing. You know all of it. Like as a like I might be having those knowledge, but I'm not able to implement it to my athlete or my make my player understand. So
ओके.
like if I'm rough with my attitude, or I'm very like I'm not open for communication, so my athlete won't believe in me itself. So that is what I feel, or over the time I have felt like that is foremost important. And yes, you need to be aware about your surroundings, because half of the time your problem is due to those, like first of all you need to identify the root cause of the problem. So until unless you are not aware of the surroundings or what is exactly is happening, so like you need to make a differential diagnosis, but you need to come to an end. So I think the assessment plays a major key role for the rehabilitation of the player. Half of the work is done over there, and then this you just have to go for the goal-oriented approach. If your goals are meeting, that means you're on the right track. First of all, finding
ओके.
track is foremost important, and
Then you
what
just
can I
have to
say?
work
Yeah,
on that track. So
and the more and more
the
you work, I think that is again a
so
crucial.
perseverance is the one
Yeah.
thing that you
Yes,
need.
yes,
Okay. So the first thing which you said was the skill. Second thing which you said was soft skill, like hard skill and soft skill. The third thing which you said was
definitely,
assessment.
definitely.
Okay. The fourth one was perseverance, and the fifth one
Yes.
was open to, yeah, like you should be aware of it. Like, and the fifth one which you said was the stick to the basics part. Okay.
And I think one more major point that I'm missing here is, like if see in today's world, in sports scenario, in particular in India, if I tell you about it's more of a coach-driven process. Everyone is
Mm-hmm.
ready to change, but unless and until you are ready to face the change as well. So like if you are like already insightful about the game, so I think that will help you in the very long term, and to gain that confidence over the coach as well, so that the player starts believing you. Until unless you only don't know about the game, so I think that is a major lacking factor. What are the demands of the game, and the player will definitely go into a re-injury. That should not be the case.
Okay, got it. So this is it. Like my questions are finished. My everything has been done and cleared. So like sir, अगर आप सर एक चीज मैं बताना चाहूंगा आपको.
जी जी.
आपके पहले एक मेरा एक लाइव सेशन हुआ था एक ऑस्ट्रेलियन फिजियोथेरेपिस्ट के साथ. उनका नाम शायद डैन डैन चैंग है. और उनसे
Okay.
मेरी बात हुई थी सॉफ्ट स्किल्स के बारे में. तो वो लाइव सेशन है अभी मेरे चैनल पे पेंडिंग है. तो लाइक अपलोडेड है, सॉरी पेंडिंग.
All
तो
right.
उनसे बात हुआ था ना, तो उन्होंने एक बात कहा था ना कि लाइक यू शुड बी कम्युनिकेशन शुड बी लाइक दिस, कि अगर कोई भी एथलीट अगर आपके पास आ रहा है तो उसको मतलब मजा आना चाहिए. कि
Hmm.
वो आपके पास आ रहा है तो उसको अच्छा लगना चाहिए, उसको मजा आना चाहिए. आप ट्रीटमेंट वो सेकेंडरी है. पहले आप कम्युनिकेट करके आप उसको इतना आप वो करो कि उसको मजा आना चाहिए. वो रोज आपके पास आए तो एक स्माइल लेकर के आए. सो एट दैट टाइम योर हाफ ऑफ द वर्क विल बी डन. तो
Yes, like very
वो और
very well
सेम बात
said.
आपने कहा वो बात.
Yes, so very
हाँ.
well said. जैसे कि कोई भी अगर प्लेयर आता है वो ऑलरेडी ही इज बीइंग इनटू अ प्रॉब्लम. सो अगर आप ही उसको पहले मतलब पहले दिन इंस्टेड ऑफ लाइक कि व्हाट एग्जैक्टली द सॉल्यूशन, सिर्फ अगर आप सॉल्यूशन बेस्ड या ट्रीटमेंट बेस्ड रहोगे, he'll go into that monotonous routine. और अगेन
एग्जैक्टली.
साइकोलॉजी अब लाइक वी आर वर्किंग ऑन दैट. एंड इफ यू सी कि लाइक देयर आर सम प्लेयर फॉरेन प्लेयर्स दोज हु हैव pulled out of the Olympics as well. So Olympics is such a big platform for a sports like for a sports people, or like it is the best among all. And see, still some players are pulling their names out of it. So that means they are working on their psychology. So psychology is such thing that you need to take care of. Yes. And in grassroots level, you always don't have a freedom to get all the sports scientists. All right. So you physio plays a major role because a player, the amount of time that player spends with you is pretty huge. So almost if you are there with an athlete, you are spending almost an hour, or like it can go plus minus, but yes, you are spending a great amount of time with an athlete. So if you are not on the same page, or if your athlete is more monotonous about it, or you are not more creative regarding your treatment as well. If he is following the same set of routine or same set of exercise thus every now and then, he would not be that entertaining, or he will lose that what can you say, that uh, उसका इंटरेस्ट ही चला जाएगा
इंटरेस्ट.
ट्रीटमेंट से.
इंटरेस्ट या.
यस. सो आई थिंक टू you also need to be understand the situation at times, कि you also need to go for कि like what extra efforts or what extra you can put into the thing, so that for a fruitful treatment or fruitful rehab.
गॉट इट. तो सर लाइव सेशन को एंड करते हैं, और एंड करने से पहले एक छोटा सा चीज बोलना चाहूंगा दैट
Sure.
कॉन्ग्रेचुलेशन फर्स्ट ऑफ ऑल, आपका जो अभी रिजल्ट आया है. और आपका जो
Thank you.
हार्डवर्क था वो बिल्कुल मेहनत आपका रंग लाया है. और आप मतलब ग्रो करते रहिए. लाइक मैं तो बहुत जूनियर हो जाता हूँ आपसे, तो मैं क्या ही आपको सजेशन दूंगा, बट आई एम वेरी
नहीं
हैप्पी फॉर
नहीं,
यू दैट.
I'm always open for suggestions and discussions, Chitosh.
So
Yes.
I'm actually I feel like there are a lot of things अब भी हम लोग डिस्कस कर सकते हैं. So I'm actually looking for some another live session with you if that's possible
Sure
from
thing.
your side. Otherwise there is no pressure at all. तो
No, no.
आप अपना comfort
You are.
zone
But
देखिए.
one thing I would like to say, like I was mentioning in the other days as well, like this is the
हाँ.
first live session for me as well. I was pretty nervous about it, and I
Hope you
what I
enjoyed
told
it.
you about, I went pretty raw. Whatever I felt like, I told you that, and thank you for definitely inspiring me and giving me that confidence. Yes, I can do that. So yeah, this was a new horizon for me. So like, but you were telling ki, you are very junior. No, definitely. Ki, see, this is also one thing that you need to be aware of. Or so, thank you Ashutosh for that and for inviting me over.
I hope you enjoyed it, sir. It's my
Yeah, yeah,
pleasure.
definitely.
So we'll just end the live session, sir. Have a great day ahead,
Sure.
and
Thank you
I'll
Ashutosh. You
just
too.
not disturb your sleep from now on.
No, that is
Happy
absolutely fine.
Sunday. Happy Sunday,
All right.
sir.
Okay, Ashutosh.
Okay, sir. Bye, sir.